Okay.
Right. I'm gonna call this meeting of the Safe, Healthy, Connected People Commission, meeting to order. Yeah, it's 6:35. The first item on the agenda is public comment for anything that is not on the agenda below. So anything that has nothing to do with the presentation on the walk bike master plan.
So for the folks that are online, you can use the raise hand feature or the chat and we'll recognize you. Otherwise, you can wait till the next item or the item that comes up that you're here for. Not seeing anything.
Okay.
Nope.
We'll move on. We unfortunately at this time do not have a quorum, so we are not gonna we'll move the meeting minute approval to the next meeting. So all our business tonight is to hear the walk bike master plan public presentation. So I'm gonna turn the rest of this meeting over to you all.
Excellent. So I'll do a real quick introduction and then turn it over to the other folks. So tonight we are here to have a public presentation on a walk bike master plan that the city has been working on through some federal funding from the Metropolitan Planning Organization through the Unified Planning Work Program as administered by the Chittenden County Regional Planning Commission. So the RPC has contracted with the firm of VHB with Jen Connolly and Elizabeth Sunberg here. We've got Marshall Distel and Brian Davis on the screen from the RPC. So this is basically a master planning effort that we've been working on most of this year with the hopes of having it all kind of wrapped up in the next couple of months. So this is a public meeting to take public comments on the plan so far and get feedback. So with that, I think, Brian, you're gonna take over, and I guess we have a presentation here that I'm gonna go ahead and launch. Actually, I'm not gonna do it that way. So one moment, and I'm gonna share my screen so that everybody can see what's going on. And okay, and then Brian, whenever you are ready for the next slide, you just want to let me know. I'll cycle through.
Sounds great. Thank you, Eric. And just to make sure everyone can hear me okay.
A little quiet. Let me bump up the volume here. Oh, that's all I get. So
all right. I will do my best to project all the way to Winooski.
If you want to move up, if you can't hear, please do.
All right, great. Thanks, Eric, for the introduction. Thanks for having us. Again, we appreciate the partnership that we have with the city of Winooski and with the VHB to work on this project. We were really excited to work on this year. We know the city's been interested in this project. It's a project that I really enjoy working on, along with my colleague Marshall here. So again, thank you for allowing us the time on your agenda tonight to present our work to date and to hear feedback from those who are joining the call today. And we recognize that not everyone can join a 6:30 meeting on a Tuesday. We will post a recording of this on the project website, and we will also offer other ways for people to review materials and get back to us with any comments. Next slide. Just a quick agenda of what we hope to cover tonight. So let's just dive right in. Next. There we go. Okay. I think we've all met each other. We've got Jen and Elizabeth in the room there. Thank you for making the trip tonight. Drew is also helping us. You've got Eric, your city staffer there. And again, Marshall and myself. And we have other staff for other, if we have other specific things, we've got other staff at the Regional Planning Commission that we can pull in as needed. Next. As Eric mentioned, we have been working on this the entire year so far, and it's been a goal to wrap it up in time so that the city can include this in their budgeting process for next year. Today is our second public meeting. We normally have 3 different public meetings at different key points We decided this time to focus more of our time and energy on the outreach process instead. We don't rely on public meetings in the same way that we have in the past. We're fortunate that people can join from home or wherever and Zoom in like this, which is more convenient. We can post recordings that people can view. We can do online surveys. So we'll cover some of that in more depth, but you'll see here, we've got a little bit more work ahead of us to come back with a full draft plan for consideration by the city. All right, as I mentioned, we've done a lot of community engagement throughout this process. We started back in April and up through, I would say, last week, if I'm remembering correctly, end of September. So we've been doing lots of different engagements, some of it very targeted towards different populations that we wanted to be sure that we heard from, and other more general input. For example, we did an online survey that people were free to take at their convenience. We also had that survey translated into a number of different languages. Maybe you saw some of the those lawn signs posted around the city with the QR codes that people could scan, and it would open up in the language of their choice. We did a lot of these different in-person events around the city, including the farmers market, the O'Brien Center, at the school, a couple of popular restaurant spots around town. So again, we wanted to make sure that we were going to different communities, different neighborhoods, even different residential buildings, so that we were hearing from the people that, sometimes we're not able to hear from, who can't join a meeting like this. So we went to the people instead. Here's an example of that lawn sign. In addition, the Vermont Department of Health thought it would be interesting to do some walk audits. So we did those through the school with our partnership with the school, which is great. They did a separate online survey as well as a caregiver survey, and they used interpreters to help with that kind of survey as well. All in all, we received about 1,000 specific comments through that process from April to end of September, which I feel we did a good job. One of my markers for outreach is if we start hearing the same comments from people, then we know we've done a good job in making sure that we're hearing all kinds of different voices about their concerns and desires.
So with all of that input that Brian has collected over the process, we then took that input and used it to help us, you can go to the next slide, to help us develop those evaluation criteria. So as you heard, we reached out to a lot of targeted groups. We heard 1,000 different points of input, whether it was from the online surveys or from in-person meetings, focus group meetings. And so we're able to, a number of themes started to emerge, and you'll see that later in the presentation, that we came up with categories of themes for types of projects that we wanted to move forward with in the plan. In addition, we reviewed previous citywide plans that had been done. A lot of work has been done in the bike and ped arena, and there are a number of suggested projects out there. So we really looked at past studies and past plans to understand what else had been contemplated and what hasn't been built, and really synthesized the wants and the needs, and spoke to city staff to figure out what else, what is kind of on the docket, what is being taken care of, and what else we need to evaluate going forward. In addition, we took a look at other walk-bike plans. There's a whole body of work that's been done nationwide developing these plans, and looked at those potential evaluation criteria and used that as a good starting point to decide how we were going to evaluate the projects as we got going. So then we met with our advisory group to talk about it, and finally got with the project team and really talked about weighting of these criteria. So again, this is just, kind of to give you some of the images of that. That is the map of the different suggestions or data points or comments that we were received, which is really helpful because we were very happy to see that we got saturation kind of throughout the city at a number of different locations. And as I said, we also looked at past scoping studies and the transportation master plan. And that all led us to, on the next slide, you'll see the evaluation criteria. So what really rose to the top of the project team and the advisory group was improving equitable access, addressing improving safety for all users, improving network connectivity, proximity to key important locations, and in that case, it's schools, parks, community centers, those kinds of things. And then supporting community and city input, because again, there are a number of projects that have already been identified in public input. So those were the criteria, and we ended up deciding, depending on what those different things were, we provided definitions and score weightings, and we evaluated these and worked with those numbers over time to make sure we got the weighting that we think is most appropriate. So ultimately then, really thinking about that equitable access and how to address safety for all users and connections to key locations, we employed a GIS analysis that really looked at where are those locations. If a project is located really close to a school, for example, it got a higher weighting under that criteria. And, you know, really try to use a more quantitative analysis rather than just a judgment. Is this, you know, does this meet this one or not? It really was based on GIS data. And then we also synthesized the public input to understand what the priorities that we heard from the public were. And that was anything from concerns in a corridor to specific locations to maintenance concerns, as you'll see in a moment.
And Jen briefly touched on the JS platform that we use for the scoring, and this is just an example of some of the data sets that we put in. So as you can see, the different school locations are the small red dots, and then the radii around them are the different scoring mechanisms. So if they're in a smaller area within the school distance, they received higher points that way, and if they were further away, they received a little bit less points. And another example is the high crash locations to see if there's a lot of issues happening with either pedestrians having issues with the traffic safety or just high areas of crash. Usually means that there are some room for improvement to help the safety for pedestrians. Go to the next slide. And as you can see here is the project list. So it took a long time to get here, and the darker the color, the lower the priority, and the lighter the color, the higher priority. So the scoring came out of what we implemented into GIS. So that was the table that Jen had showed with the different points. So we used all the different mechanisms to come up with a score to help prioritize the projects. And then if you want to go to the next slide. We broke them out into 3 categories, and the first one was scoping studies. And for one of the corridors that was prevalent in the public comments was the Fountain Street, which is currently undergoing a scoping study, which is awesome. That effort is already underway, and we're hearing that that is a problem area in the city. And if this group doesn't know what a scoping study is, that is a study that in this particular case, the city is undertaking to evaluate how to address bicycle and pedestrian needs in that corridor, or it can be traffic operation needs or other things. But it's really looking at different constraints and alternatives for how to address the goals of the corridor. So the good news is Elizabeth just says a number of these corridors, and this one is currently in scoping, but a number have already been identified for future scoping.
I would just add, excuse me, sorry, that the funding that we received to do this project, we're going to apply for funding to do a scoping study on Malice Bay Avenue, hopefully either next year or the following year. So that's next in the city's priority queues for a scoping study.
And the other key corridors that we heard about, East Spring Street, Weaver Street, and the circulator. Go to the next slide. So these are all the infrastructure projects that we had sifted through all the different criteria to come up with. The highest priority from the public was infrastructure along Main Street, which is currently out to bid for construction. So there are going to be a lot of improvements to crossing and pedestrian safety and some bike infrastructure as well. So it's good to know that what is being heard will be addressed. And then another key corridor that was brought up a lot was East Allen Street, which there was a scoping study that was done in 2019. So there are some alternatives and preferred alternatives that were voted on by the city of Winooski, so implementing those in the future would be great, which is why it's an infrastructure project and not on the scoping, study list. And then
The last type is the maintenance priorities, and we got a lot of feedback about maintenance items. And by maintenance items, that can be anything from snow plowing of sidewalks to line striping to, we got some concerns in particular, like of a sidewalk, the trees, the roots had really grown up and made it so that, if you were, wheelchair, you would have trouble traversing it, and it was a trip hazard for pedestrians. So one of the things we're doing is having another category for maintenance priorities, and I did see John joined the meeting. One of the things that we did do is speak with Public Works about this, because a number of these things are already identified. For example, you may have a concern that your sidewalk isn't plowed soon enough, but the city has gone through a similar process and developed this like priority plowing plan so that it explains. And so one of the things we're going to do is go through and identify for the maintenance concerns that were raised, either what the recent challenge has been, or why things are done the way they are, or how, if you do have a maintenance concern, what the proper process is for addressing that. So we are not, although typically walk-by plans might not concentrate on maintenance, in this particular case, we see a real need, and so this plan is going to talk about that as well, just so that there can be some direction on maintenance as well. So the next steps here are to evaluate the infrastructure project. So as Elizabeth pointed out, there were a number of projects that were identified where there was a specific request. Can you put a sidewalk on the street? Can you paint a bike lane? Some of that is very easy. We can look at the available right of way and we can comment directly, are those things possible? As we've already talked about, when a number of those items were raised in a corridor, we would recommend that for a scoping study, because if it isn't just a single location, if it is more a corridor of concern, like Mallets Bay Avenue, that's more appropriate for a scoping study. How can you take a look at the entire corridor and decide what those priorities are? But as a part of our plan, we're going to take a look at kind of the singular locations and at least provide some guidance as to whether some of those things are possible. For example, we know that there's at least one road in town, and I'm sure there are a number of them, that there isn't enough right-of-way available to provide sidewalks on both sides of the street. And so in those cases, it is important to have some kind of an evaluation or what to do with that roadway width. If you cannot accommodate a sidewalk on both sides, which side is the right side, or is it better to have a striped shoulder, or, there needs to be further evaluation as to what is appropriate in those cases. So we think there'll be a number of locations that fall under that. After that, we'll be developing that walk-bike plan and ultimately presenting that to the city council. And with any comments we get back from the city council, we'll finalize that plan. And then that'll be the plan moving forward, and that'll be, the city's roadmap for how to address, how to prioritize scoping studies and how to, address infrastructure needs moving forward.
I think right now our schedule is to have that presentation on the draft plan to the city council at their December meeting.
And if you want to provide any further input after tonight, we'd love to hear input tonight, but after tonight, Brian and Elizabeth's information is on the screen, and we would love to hear from you.
Right?
Do we want to take questions? Happy to.
Yes.
I'm happy to go, yeah. If you wouldn't mind backing up a few slides to the identified priorities, I think it was a slide or two before the maintenance slide, if I remember right. Be that one, it's just under Brian's face there.
Sorry, Ryan, I want to move you again. This slide?
It might be that one or the next one.
So there was then scoping, so the overall.
There it is, this is.
Okay, let's start
Yeah.
there, sure.
So what I noticed is on the previous two slides, East Spring is highlighted, but it's not, doesn't appear to be highlighted here. And it would be that section just to the left where the arrow is pointing to the scoping study in 2019, that section right there. I know it's been identified for not having sidewalks or bike lane or anything. It's a glaring change. There's sidewalk, then all of a sudden nothing.
Yep.
Can you explain?
Sure, so
What
we'll go
happens
back
next?
to scoping. So this is one of the corridors that we identified as needing to have some additional scoping. Because there was a lot of needs identified, the challenge will be, I don't know, if all of the needs can be accommodated. So there might have to be a prioritization done, like, is there a sidewalk on both sides and no bike accommodation? Is there a shared use path on one side? Are there bike lane stripes or what? Where should the crosswalks go? There's gonna need to be some additional scoping done. So that's why it's on, it was identified as a priority, but because the needs or the requests were varied, and we're not sure if they all can be accommodated, it was identified as a scoping priority.
Great. And then the intersection there where it meets East Allen,
Yes.
I know is identified, and I don't know if you can
Yes.
speak specifically if that falls in a scoping study or if that's like, if there's a quick fix type, what that would be.
Sure. So I can address that a little bit, and there are other team members who might be able to help out. That was a part of the East Allen scoping study, and that entire corridor has had some short-term improvements that came out of that scoping study already implemented. And I believe the city is on a plan to try to continue to implement those improvements. And that intersection came up very high on our engagement, many people, and I agree with you. My comment, anytime I heard someone in person say that, I said, I don't even love driving through that
No.
intersection. So I completely understand how you would feel on bike or walking. So we understand that it is a priority and there are improvements that are recommended. I don't know if someone else who is online, whether it's someone from our project team or from someone from the city, could comment at all on thoughts about other improvements at that location. But there is a scoping study that did recommend improvements at that location.
Can I ask about that scoping study? So, I see the date was 2019, which obviously is like kind of during or just prior to the major developments that have occurred there on East Allen, which have essentially completely changed landscape of the street from that intersection essentially all the way to the interstate. Do they revisit these scoping studies to take into account that it doesn't look anything like it used to?
Yes and no. So they won't revisit the scoping study. What they will do is if funding is allocated for it as the project moves forward to design. So for example, Main Street, there was a scoping study completed for that, but as they got into design and really got a survey, for example, and dug into what actual constraints were on the ground at the time they were doing the design morphed over time. So what ends up getting designed and built isn't gonna probably be exactly what was in the scoping study, but it gives the designer the bumpers as to what the city wanted at that time. So if the conditions have changed, then the design will likely change as a result.
And I have the last one on that point. Sure. And it might be for Eric, or potentially for John, if he's still on the phone. When developments go up and changes to the roadway have to be made, do they reference the scoping studies and any findings that may have come out of those before they make decisions on how those roadways are reconfigured, islands are placed, the dimensions, all that stuff? Because my sense is that that intersection has become a little bit dicier in the last few years, just with the nature of it. It's been squeezed, which I think in theory slow cars down, but frankly, it's just sort of increased range a little bit and people's gunning out through that intersection, trying to beat cars that are coming down the road and having a tighter turn lane and all that. So the question specifically is, are decisions made based on previous scoping studies, or are those simply just documents that don't interact, or conversations that interact with previous documents?
So I would say yes, decisions are made with those scoping studies in mind, in particular with East Allen Street. There were, I believe, 3 different treatments for the roadway. One was basically a kind of a paint treatment, which was more of a short-term plan or short-term option. Then there was at least one long-term solution, or long-term proposal, which would involve moving the curbs in to add more sidewalk, more tree belt, things of that nature. What's out there right now, for the most part, is consistent with that short-term, the short-term plan from that scoping study, as far as removing, basically going to the center turn lane, removing kind of that, I'll call it the slip lane off of East Spring Street, adding the bike lanes on street. A lot of what could be done with just paint, basically. Also involved the refuge island, I believe on the Dion Street intersection, and moving the refuge at the Manso Street and adding in the rapid flash beacons as well. So what's out there now is consistent with what was done, what was shown in that scoping study from 2019 for that short-term treatment. Also, to your other question, to the extent possible, when a scoping study is done for something like this, and we do look at land use and what could be built in some of these corridors, not necessarily what will be built, but what could be, and try to kind of plan around that to the extent possible. So there's at least an acknowledgement that on some of these corridors, development is expected to happen, and what kind of the general parameters look like for that development. So to the extent possible, we try to plan for that new development as well in the corridors. Thanks.
Anyone else, either in the room or online?
So the circulator, I guess, could someone describe its priority compared to the other sections of the city?
Yeah, so if you go to, I'm trying to think, it was in scoping, yeah, so it's like middle of the road, as you can see, it doesn't hit the priority of Weaver and East Spring, or Mallet, well, similar to Mallet's Bay. So as far as the things that are identified for scoping, in particular, the requests at that location were really to evaluate how bicycles and pedestrians interact with the circulator, what was the request. And so we don't see that as simple as us saying add a crosswalk. That's something that someone would really need to do a more global study and really think about what could happen there and what those impacts would be, because obviously that also causes a chain reaction throughout the system. So that's why that's identified for future scoping at future time.
I guess, could you describe, it would seem to me, just someone who walks around the city, that it of course has like the highest density of people and cyclists. It's also a conduit to Burlington. So why would it not place given the highest priority?
It was based, like I said, on those criteria. So there were 55 potential points. And it didn't, weighing those things, weighing, whether it's not close to the schools, it's not, really going through that independent criteria with using GIS, it didn't rank as high as some other potential projects.
I guess I would just question.
Yeah.
Exactly question the criteria, just given.
Yeah.
I mean, any time of day.
Yeah.
You're just gonna, if you wanna see where people are walking and biking, it's
I will tell you.
like certainly cost efficiency of like projects.
To the top, and Brian might be able to comment on this. He went to more public engagement than I did. But it did raise to, people weren't just concerned about crossing and passing through the circulator. I can tell you they all talked about that bridge. I mean, that's something everyone talked about. Many people talked about East Allen. There were a number of things. The circulator, although a concern wasn't in the sessions I participated in, didn't rise to the top either in the public engagement. So I'm not surprised it isn't white. Because it certainly wouldn't, in my mind, have risen to the top based on engagements that I did.
Okay.
Could you explain a little the evaluation criteria between GIS analysis and the synthesized public input and how you brought those together to create the priorities?
Yeah, so what we did is like project creation. So we really took the public input, and whenever we had folks at any certain level, more than just one person saying, I'd like the sidewalk outside of my house wide, that would be more convenient for me. But as soon as a few people commented on something, we tried to generate a project that was around that idea. Like what is the concern here? What would that project look like? And would it be a corridor, would it be a pointer, that sort of thing. And so the public input was used first for project creation, for us to just brainstorm, like, okay, there's a few people have an issue here, what project could address that? Then those projects were added to, again, all of the projects already on the books anyone has identified, whether it was in the recreation plan or in the town, or the
Mhm.
transportation plan, a number of these corridor studies, those kinds of things. But it also weighed into the evaluation criteria. They also received points based on whether we heard it, whether it was identified through previous engagement or whether we heard it during this engagement process. So it helped us generate projects to address needs, and it also helped us because there were points assigned to it in evaluation. Whereas the other items were based more on, purely, is there a network piece missing? Is there, an ADA concern at that intersection? Is there a school that folks are walking to? Kind of those were much more quantitative based on GIS evaluation for those points.
And I have one more question, I guess. Early on, you mentioned that as you talked to folks and got more into the work, you started to identify themes.
Mhm.
And I'm not really seeing where the themes would be in these
So
slides.
the themes are scoping was one of the themes.
Okay.
Like there's an entire corridor that some people want a bike lane, but other people want a sidewalk. And we might not be able to accommodate both. So that theme is, that needs additional study.
Okay,
So it's a scoping theme. Whereas others are pure infrastructure. Why isn't that shoulder striping, that's something, that's more like we can do something for infrastructure. And then others, as I said, the third thing really was that maintenance. That there was a concern about maintenance in general. And a lot of that, is already, like I said, documented, or there was an issue with striping that has been identified and has been corrected, as we know that they're going around the city now striping, so there certainly are a number of maintenance issues. So really, the feedback kind of fell into those three categories, I'd say, or themes.
I can share a little bit. I got to see the evaluation criteria, so I'll just speak to what I saw missing in the criteria, which I think would be valuable to add. You've sort of touched upon it. One is is there any existing facility? So specific to sidewalks, I think is really valuable, especially when we're talking about our major corridors, which you identified as Main Street, Malatea, East-West Spring, East Allen. The only part of those corridors with significant ADT, right, is that segment on East Spring that doesn't have a sidewalk. So I feel like because it's a main corridor and because it doesn't have a sidewalk on either side, it should become a higher priority. And then the list of previously identified projects, I would just have you kind of get with John to relook at that list, because it looked like that's an example of a project that has been previously identified that was given 0. And there is, I think it's worth noting the access to parks, because really Casavan, if you're coming from any of those neighborhoods from Casavan Park, you have to go along that corridor. So just giving sort of a little color to that, to the criteria. And another observation was we're primarily a walk district. We've had some busing introduced for the schools here in the recent past. But we certainly have students walking from further than a quarter mile. So considering, between that quarter, half mile, or even beyond, giving them points, even though it's not right around the school. Many of us are walking to school. And then the last thing I'll say is the rotary. I know that the bridge study we have the bridge study coming, but there's a crucial connection between that bridge into Winooski. And I'm wondering if your scoping study box can widen to address that
That's
connection.
addressed at that time.
Yeah.
I think that makes sense.
So Abby, to your point about walking to school, a separate piece of this, a piece unrelated to this project, but to be incorporated, was the Department of Health just did some walk audits. I don't know, Brian, if you can just provide a little few more sentences on that, those walk audits and kind of what the next steps for those are going to be.
Sure, thanks. Yep, so the Vermont Department of Health worked with Patrice at the school there, and there was a middle school class and a high school class. They both did 2 separate walk audits that covered each walk was basically a mile. And so we had the students with us pointing out different things that they encounter on their walk to and from school, whether it was crossings or sidewalk issues or lack of sidewalk, or, and we asked different questions about, do you also bike around the city, and where you go and where is it hard? So I just sent all that information to the VHB team today, because those were, we just wrapped those up last week. So I've got the sheets that the students filled out. Department of Health came up with their own little sort of map and different sheets to fill out different things, so people could have a clipboard as they're walking, fill out, identify different things, whether it was infrastructure related or signage or driver behavior, personal safety. It was beyond just sort of the physical infrastructure. It was about the whole experience itself. So we've got those specific papers. I went through all the comments and kind of grouped them, because I knew VHB's process in identifying different themes and locating different areas in the city. So I kind of did a little bit of that work for them. And then the other piece again was a survey of the caregivers. And I think we got about close to 100 responses, balanced between an online English version and then also an interpreted version that was very similar, asking the same questions, but in a slightly different way. So we have, beyond that shorter radius to the school, we've got more of that input from people who are traveling to and from school.
Right, and so not all of the input has been considered at this point, and we have received from both the project team and from other folks, some comments. So your comments are very welcome, and we'll be considering that and reprioritizing. But wanted to come to share this so that if there are other concerns, other projects that should be considered, or other things we either may not have thought of or should be thinking about, just to get this additional point of information.
And Jen, I also add, those were the two, a middle school and a high school audit. There was the Winooski Partnership for Prevention, also has a group of students. They did a walk in a different part of the city. And then the Winooski Alliance for Active Transportation, and thanks to Susan at Locomotion for helping to organize that group, they covered a different part of the city. So in all, we did 4 different walk audits that covered different parts of the city.
I just have a question about this slide here. Why is that section on Malice Bay Avenue not on the scope of priority? There's like that one section that's kind of missing.
You mean right here under the word?
Yeah.
Oh, I think that's just because the text of the word in the background and the word.
Okay.
That's cool.
Okay.
Yes.
Okay. So it's the whole thing.
Yeah.
Okay. And I guess just following up on the earlier question about the scoping studies, we know Malice Bay Avenue is going to be developed.
Mm-hmm.
So if there's going to be a scoping study in a year or two, as Eric mentioned, are we going to end up with a similar situation like what we have up on what is that? East Spring, where the new developments, I always get.
East Allies.
So are we gonna end up with a situation like that on Malice Bay Avenue where we do a scoping study, a whole bunch of development happens, and the scoping study doesn't really reflect the current situation?
Yeah, what I think, unfortunately, with the time when the East Allen scoping study, not much has happened. But I think the intention, and as Eric shared, the short-term improvements have been implemented over time, and I think there is a plan to continue to advance the longer-term improvements, and that would really be similar on Malice Bay. If we are able to, if there's a desire to stripe the bike lane, get that into the striping plan for the city, so that at least the short term happens, and then look at what the other improvements are and plan how that infrastructure can be improved over time. It's basically to help the city create a roadmap, and then when it comes times to go to city council with, new budgets and with, what are the priorities, there's a roadmap for what the folks do want to happen on those roads. But it definitely takes time.
I have a question for Aurora as a council person, I know it's budget time now. Is there any chance and the recommendations presented here could be in this next year's budget cycle?
Well, it kind of depends on the presentation. It sounds like if it is coming in December, that it is. I can also share that, at our previous council meeting, we staff asked us to identify which is kind of the areas in our master plan to focus on, and the majority of the council said municipal infrastructure. So it's very, very high on council priority to think about municipal infrastructure, because that is what we're hearing has the most area of need. And some of that has been previous underfunding, so catching up from the pandemic, and from, trying to just keep things up versus trying to make sure that we have what kind of
Right.
going forward. Yeah.
Okay, thanks.
Yeah, and we're conscious about, and one of the things that I think is important to note, and we'll make very clear to the council, though we appreciate you being here, is things like the maintenance issues, the striping. That was a big comment we got a lot. And, I know some of it was budgetary, and some of it is that then trouble getting the line stripers here if you weren't already in the queue. So, kind of a double whammy there, but things like that, just how important it is to let the council know how much we heard, how important it is to people that those things are kept up. They really need those, those edge lines striped, those crosswalk stripes, that is a real, even if you're not improving, that keep, at least hold the level of safety.
So Mary, we've, at least one person online looking to provide comment, so.
Great.
Stephen, you can go ahead and, unmute yourself.
Hi, thank you. Can you hear me all right?
Yep.
Great. Thanks for taking my question, and thank you also for the presentation. I'm really excited about the progress. I've been following this work closely for the duration. And I've always kept an eye closely on what's happening with the schools and making sure that our school children have access, safe access, whether they're walking, biking, or taking the bus to school. And I've been really glad that the work so far has taken into consideration the walking routes of kids in Winooski. And as we're discussing this and I'm kind of looking and kind of focus on the map of Winooski, I was wondering about the school bus routes and the school bus stops, which are places where, our kids congregate every morning and just first in the afternoon, and wanted to find out whether that has been taken into consideration in terms of ensuring that those are places of high traffic for small people, and I feel should be prioritized when considering making sure that we have safe places to walk and cross streets.
That is a great suggestion, and I will say that we did not take into account where school bus stops are. One of the things we'll have to track down is that something that changes over time, or if those are preset locations, if we're going to give it a priority. But I'm happy to look into that and give some consideration to how to incorporate that.
Thank you very much.
If there's anybody else online that has any comments, you can use the raise hand feature of the chat. Otherwise, we'll keep taking comments here in the room if that's what you're comfortable with.
Anybody else?
I was wondering if any off-street grid projects were pursued. Just thinking about there's some informal connections that are really helpful when you ski. So at the end of Tigan would be one example into the North Street neighborhood. On the other end of the North Street neighborhood into Landry is another really great off-street connection. And I always wish there was a great connection on the super block, which is what I consider the block between Barlow and Hood with East Spring and East Allen. It's got like Winooski Housing Authority buildings on it. It's got the St. Stephen's Church. There's this large block that you can't traverse north-south on. And wondering if there's opportunities, especially because it's Winooski Housing Authority land, to maybe open up access. It's got quite a large fence around it. And the Barlow Street property is used very actively as a cut through. It's under consideration for redevelopment. So I wonder if there's any opportunity to have something in our plan, so when redevelopment happens, that's considered.
Consideration. No, that is a great suggestion. We can take a look at some of those potential connections. I know when we did some engagement, some of those more informal connections came up. Very tough for the city to move forward with something themselves, but as you said, it is nice to have those things identified so that if a developer comes forth, at least it's identified in the plan as something that the city would like to pursue if they could incorporate.
Yeah, there's another example at the back of the school. There's a connection on like a cul-de-sac route that doesn't have, it's like curved. So it's people are walking, biking, but it's not ADA accessible. I don't know, things like that. There's really great connections. And I wonder if this plan is a place to sort of point those out and offer suggestions for improvement.
Yeah, we'll certainly take a look at that.
I did capture that comment about that missing curb cut at the top of that cul-de-sac.
Yeah, cool. Thanks.
Yeah, it was great. You know, we knew of some of the informal paths around the city, but it was very helpful during the outreach to learn about a couple of the other ones. That was one of them up there. You know, some of them exist on private property, so at some point it's up to them, the landowner, about how comfortable they are making any improvements to it. But it is something that the plan will recognize.
Other questions, comments? Anybody in the room or online?
There are no hands raised currently
Alright.
online or anything in the chat currently.
Any final comments?
Can I just maybe put up the last slide again?
Oh, yeah.
Ryan and Elizabeth's contact information. We'll just share our contact information one more time in case anyone who's online wants to reach out later, or someone who watches this video at a later time can certainly still reach out and provide some input.
And this will be up on the city website.
We will put it on the project page
Okay.
from the CCRPC, which was, I believe, linked. Yes, it's linked in the agenda.
Okay.
Thank you all for providing your comments.
Well, thank you for coming and sharing this document. It represents a lot of work and a lot of thought. We appreciate it. We do not have a quorum, so I don't need any moves to adjourn. I can just say, we're done. Thank you very much.
Thank you, Mary.
Thank you all very much. Have a good night.
Bye.
Bye.